Rise and shine, everyone. Good morning. Thank you for joining me on this early Friday morning on September 5th, 2025. I'm Ellen Tibbetts-Hurst, and you are watching WEAC TV 24's Rise and Shine with the Alabama Cares program. Can you guys believe it is already September? Time just flies. We have another great program lined up for you this morning. We have Dr. John Gatell with us this morning. He is with the Atlanta Scoliosis Center. Good morning, Dr. Gatell.
Good morning.
I'm so glad that you came today. I'm going to let you tell a little bit about yourself before we begin. So you're a doctor at the Atlanta Scoliosis Center. So tell the audience what that is.
Sure. So the Atlanta Scoliosis Center, it's in Noonan, Georgia. I've been practicing now for about 12 to 13 years. Our clinic is focused on treating scoliosis non-invasively, so non-surgically, non-invasive through therapies and rehab. We incorporate also specialized custom braces for patients with scoliosis and other spinal deformities or changes.
Okay.
Yeah, and
wow.
we're in Noonan.
Wow. And you know, scoliosis is something that, I remember when, as a child, we used to get screened for that in school, if that was just a given. Do they still do that?
Yeah, it's a great question. They do. It depends on the state and then also even the county and the school. But the last time I checked, they still do it. It's usually in middle school. It would be great if it was actually done also in elementary school too, because a lot of times in juvenile cases it can start as young as 9, 10, 11.
Oh wow. So what is scoliosis and why is it important to detect it early on?
Yeah, so scoliosis is a curve, a bend in the spine. It can be a C-shaped curve or an S-shaped curve that develops in the spine. It can be most commonly in an adolescent or a juvenile. The actual cause or etiology of scoliosis is still unknown.
Oh wow.
Yeah. So.
Wow. So sideways curvature, you said, or S, and is it caused by, is it more detective, you said, during growth spurts? Yes.
So what usually it's detected, like you said, at school by a nurse, or if they're doing one of the screenings. The test they actually do to check it is called an Adams bending test, which is basically where you bend at the waist and you
dive. I remember that. Yeah.
Yes. I remember it too when I was in.
Yeah.
It was done. I remember by a PE coach, but that check is done at school, which is great again for early detection. The problem is that it can get missed. So especially depending on the type it is, a lumbar scoliosis is more commonly missed when they do that test versus scoliosis in the upper part of the back. It's more visual.
Oh, okay. So early detection, I assume, probably is the best way to go because you have better outcomes and it prevents it from being worse, correct?
Right. If we can get in front of it, because scoliosis is progressive, the time when it increases the most is when children go through a growth spurt. That's when it can actually jump the most. By definition with scoliosis, there has to be a curve or bend. The measurement that's done, it's called a Cobb angle measurement, which we take off an X-ray. And that bend has to be over 10 degrees for it to be by definition scoliosis. Mild is 10 to 25, moderate is 25 to 40, and then 40 plus is considered severe, and we treat all those.
Oh, okay. So we were talking about how you detect scoliosis in children. We were talking about how at schools, one way to do that, right? So what are some signs in children that parents could maybe see?
Right. So a lot of times parents, they'll be the first ones to see it, especially in the summertime, when kids are in their bathing suits or whatnot. But the first thing to look for is the shoulders or the hips will be unlevel. That's one of the first things that people will detect. When you're looking at someone from the front or from the back, the distance between their arms and their torso will be uneven on one side. A lot of times the hips, there'll be an indentation on one side versus the other because of a lumbar type curve. We'll see changes in the shoulder blades. Those are some visual cues that people will notice.
Right, wow. So screenings at school, pediatric visits, and X-rays maybe?
Right, so what would happen if it was caught at the school by the nurse, in Georgia and Alabama, it's pretty similar, but they'll usually refer out to the pediatrician, and then depending on the pediatrician, they may refer to the children's hospital or to an orthopedic clinic, again, depending on what they're finding. But once they are seen by that first doctor, then x-rays are typically recommended to confirm. Some clinics, like what we will do as well with a visual check, there's a tool called the scoliometer, which is a level, and you can use that to also check and identify scoliosis. There's actually, it's pretty neat. If you have an iPhone, you can actually type in the word measure on the iPhone, and it has a built-in level. And so this is just a fancy, this is a fancy level that you can use. The scoliometers are like $50, but you can literally use this and put it on the back when you're doing the screening. And if it's over 5 to 6 degrees, an X-ray would be warranted. So that's one way to easily check on your phone even.
Who would have thought it? Yeah. That's pretty cool information. So how, the children, and I guess adults too, but how about adults? I mean, when did they usually detect it for those that have never had a screening or anything like that? I mean,
right.
How do they know?
It's usually, well, with adults, a lot of times it'll be once the symptomatology occurs. So, and it can be, depending on the adult, it could be later on in life. It could be late 20s, early 30s, when all of a sudden they'll start to have pain in their back. They'll have numbness, tingling. They could have muscle soreness or fatigue. And then that's usually when they're either finding us or they're going into another doctor because of the back pain, which is one of the most common reasons people even go to any type of healthcare provider.
Right.
So, but it's very similar. You still need to do a thorough eval, and then you would do x-rays to confirm if the degree and the severity.
So are the signs, I guess, the same as maybe children, and even waistlines, hips,
right, visually,
that kind of thing?
Exactly. So those would be the visual cues. Again, the only additional thing that would occur, because with kids it's uncommon, kids typically will not have any symptoms or pain, and if they do, that could actually indicate that it's more sinister. So like in those cases, we would usually recommend to have an MRI done so we could rule out tumors or other pathologies. So,
okay, so with adults, I guess, would more than their back be hurting? Like, would it cause pain other places?
It can. So again, it depends on where the scoliosis is and if the scoliosis is the cause of the pain, which can happen. They may have neck pain, back pain, shoulder pain. They could have tightness in the muscles. They could have neurological type symptoms, numbness, tingling, pins and needles, pain in the extremities.
And it could it stem from them not being diagnosed as a young child? Or can scoliosis just form later on in life?
It can. That's another great point. So the most common type of scoliosis is idiopathic scoliosis, and adolescent idiopathic scoliosis to be specific. That affects about 70–80% of most cases. And then there's another type of scoliosis that's actually more common for adults 55 years and older, which it's called degenerative or de novo scoliosis. And so that's basically it will develop 55 years and older. They had no scoliosis as a child, completely fine, but then an injury, trauma, some kind of degenerative process occurred, and then as they're aging, it becomes scoliosis, and that affects 1 out of 3 people. So. Oh
wow! So maybe a lot of degeneration in their back is caused by that.
Sure, it can kind of go both ways, but usually the degenerative change will then cause malposition and changing of the vertebral bodies, where instead of them being rectangular, they'll start to become wedge-shaped, and then that creates the scoliosis.
And so you said that imaging is usually required for that as well. And so when you see older adults too, you see, people think that maybe it's just osteoporosis and scoliosis linked in any way? Like you'll see people that have osteoporosis and they have that curvature, or they have they're not walking right, their body's off kilter. Is that any way linked to each other?
I think there can be a correlation, especially with age, but not necessarily. Okay. It doesn't have to be. Again, when there is osteoporosis or osteopenia and there's a decrease in the bone density, it just means that they're going to be more susceptible to having fractures, for instance, in the bone structure. So that's why it's even more important to do something to help stabilize their spine and to strengthen those areas that are affected.
And so when somebody has all these diagnoses, so they can come to you, and and I know that you said that you guys do therapy and all that, but in a little bit more detail, what is it that you guys can do?
So I'm one of 20 doctors in the United States that are certified to do the clear scoliosis treatment method or protocols, which are a non-invasive, non-surgical treatment for scoliosis. It involves about 6 different types of therapies and rehab specific to scoliosis. And then we also do mirror image overcorrective bracing. So it's a combination of all these non-invasive treatments that help us to not only stabilize scoliosis, but potentially even reduce it. And in many cases, we have people coming, because we're one of 20 doctors, we have patients coming from all over the Southeast. My main clinic is in Noonan, Georgia, by the airport, so we'll have people drive in, fly in, and they'll stay usually for, depending again on the case and the severity, it could be 1 to 2 weeks, and they're doing therapy every single day.
Right.
Versus if you were to go to like a general, physical therapy or general practice to do basic treatment or chiropractic. The major difference is we are focusing on very specific treatments to help stabilize the scoliosis, and we do it literally 5 days a week. And then we reassess. We will literally reassess the patient to track to see the improvements, and then make treatment plans for what they would do at home, whether that's exercises or bracing or both.
Okay, so that's interesting. So don't ignore your signs, and early detection matters, I take it. So they can visit atlantascoliosis.center.com, right?
That's right. That's our website, atlantascoliosis.center.com. That's a lot of words.
Yes.
That's our website. Again, if you even just Google scoliosis treatment or non-invasive scoliosis, we're one of the first to usually pop up because there's so much research that actually has gone into the clear treatment method. So, but yes, atlantascoliosis.center.com is our direct website to find more information, or even to set up a free phone consult. I do that typically for patients who just have questions, or even for doctors. I have doctors all the time who'll send in cases just to review, to have a second opinion, and we do that for free on the phone.
Okay, that's wonderful. So make sure that you can go to that, the atlantascoliosis.center.com, and I need everyone to hold on to that thought because we are going to take a short break right now for a word from our supporters, and you are watching WEAC TV 24 Rise and Shine with the Alabama Cares program, and we'll be right back.
I want to live. The leading cause of death of young Americans like me is gun violence, and oftentimes tied to substance misuse. NBA, NFL, NCAA, most of you look like me, and our communities need you now more than ever. Let's make I want to live more than just a hashtag. Let's make it a movement. I am a baller against bullets.
I'm Alan Parnell, the Parnell Insurance Agency. We've been here in Oxford and Alabama, Tallapoosa, Georgia since 1990. With Auto Owners Insurance, we're able to give customers competitive pricing along with excellent coverages. Parnell Insurance can handle all of your personal, commercial, and life insurance needs. We have a very experienced staff, both personal and commercial. All together, we've got about 125 years experience. Come see what our insurance agency can do for you in Oxford, Alabama, and Tallapoosa, Georgia.
Auto Owners Insurance.
Hey guys, this is Blair Smith at Pediatrics Plus here in Anniston, located on Henry Road. I'm over here on the well side, but we do also have a sick side urgent care if you need us. We are more than happy to see you guys. Just come on, check us out if you get a fever, cough, or cold, or want to come in for a good checkup. Thank you.
Backus Bibles and Books is dedicated to providing churches as well as individuals with products and services geared towards strengthening every relationship with Christ. We specialize in Bibles, Bible imprints, Bible restoration, church supplies, home decor, gifts, and apparel. Call us at 256-201 1202 or visit us Monday through Saturday, 10 a.m. to 6 p.m. at 1100 Highway Drive in Oxford, Alabama. We look forward to serving you, equipping the people of God to expand the kingdom of God.
Episode 2, Understanding Scoliosis Neck Pain. What are the different spine segments and their roles? The human spine is an incredibly complex structure made up of 24 individual vertebral bodies plus the sacrum and the coccyx. It isn't just a stack of bones, it's a living, moving system designed to protect the spinal cord, support body weight, and allow flexibility. The cervical spine, or the neck, has several vertebrae. It's the most mobile part of the spine and allows you to nod, turn, tilt your head. But because of its mobility, it's also vulnerable to misalignments, injuries, and degeneration, or arthritis. The cervical spine also houses nerves that control shoulders, arms, and the hands. When we look at the thoracic spine has 12 vertebrae. They're all connected to the rib cage. It's less mobile than the neck or the low back, but it's built for stability and protection. It shields important organs like the heart and the lungs and helps maintain posture. The lumbar spine is made of 5 vertebrae. It bears most of the body weight, absorbs stress from lifting, twisting, everyday movements. It's powerful but prone to problems because of the amount of stress it handles. Together, these sections balance flexibility and stability. In one section is out of alignment, it can affect the other, which is why scoliosis has such wide-ranging effects throughout the body. Again, when we look at this, it's important to look at the whole body, not just individual segments. How does scoliosis affect the cervical spine, and how common is it? When scoliosis affects the cervical spine, it changes the way the vertebrae line up in the neck. Even a small curve can cause big problems because the neck is so critical to balance and nerve function as well. A curve here can tilt the head, strain muscles, and change posture all the way down to the hips and the feet. Again, we have to look at the big picture, not just segmentally. Scoliosis in the cervical spine may compress or irritate spinal nerves. That can lead not just to neck discomfort, but also symptoms in the shoulders, arms, and even hands. Over time, abnormal mechanics can wear down the joints. It can speed up arthritis and reduces shock absorbing abilities of the discs. You have to remember the discs are made of almost like a liquid gel material that absorbs all the downward forces onto our body. In terms of how common it is, cervical scoliosis is less frequent than curves in the mid-back or low back, but it's not rare. In adults, especially, we see it linked with age-related spinal degeneration or arthritis. As discs wear out or arthritis develops, small curves can form or worsen in the neck. In children and teens, cervical scoliosis is less common, but still appears, particularly in more complex or severe scoliosis cases. Recently, I had a patient who came in with a larger upper thoracic curve. And remember, our bodies are so intelligent. If we have a curve bending to the left in the upper part of our body, the head has to always look at horizon, so the body will create a secondary curve into the neck. What are symptoms of cervical scoliosis? Symptoms can vary, but some of the most common include neck pain, and stiffness that doesn't go away, usually lasting longer than 2 weeks. Headaches often starting at the base of the skull and radiating forward. Can even feel like pressure or stabbing pain behind the eye. Again, this could be related to a cervicogenic headache. Radiating pain or tingling into the shoulders, arms, or even the hands if the nerves are compressed. We have to remember that the peripheral nerves that come from the neck go into the hands and the fingers. And there is a dermatome pattern or a map right out of the Gray's Anatomy textbook that shows where all the nerves go. C5 goes to the shoulder and into the elbow. C6 are the first two fingers, the thumb and the pointer. C7 is the middle. And the ulnar nerve distribution is the latter two, T1, the ring finger and pinky. So again, we can even identify which nerve roots are being irritated based off of where those nerves go and that dermatome pattern. Muscle weakness, especially in the upper back or arms, and reduced range of motion, it makes it harder to turn or tilt the head. It's funny because I usually have a patient who will talk about how they can no longer back out of their car, or they have such a limited range of motion that they can't look over their right shoulder, or either case. Normal range of motion in the neck is about 80 degrees for rotation. So and if you think of like a right angle, it's just under that. Beyond these, some patients notice change in posture, like one shoulder sits higher than the other, or their head tilts slightly to one side. The tricky part is that these symptoms overlap with many other conditions, things like pinched nerves, whiplash injury, or even tension headaches. That's why a proper eval is so important. Through the physical exam, posture assessment, imaging, and x-rays, we can confirm whether scoliosis is playing a role and design a treatment plan that addresses the root cause instead of just chasing the symptoms. And that's, again, what separates the Atlanta Scoliosis Center at our clinic. When we do an examination or evaluation, when you come in, we would do all the orthopedic tests, the neuro tests, full range of motion testing. We were going to get x-rays of your neck if it's necessary so we can rule out if it is caused from cervical scoliosis. And if you've had scoliosis diagnosed as a child or adolescent, there's a much higher chance that it has progressed if that scoliosis was over 30 to 35 degrees by the time of skeletal maturity. With that all being said, even if you can't see us, we do have a lot of patients who do come from out of state. They will come to our clinic, or we'll do a free consultation over the phone just to review the case, or if you've had images taken at an outpatient facility, or we can even order the images to have them done, and you can send those and then we can review it once you receive it. But I like to do free consultations for patients over the phone just to get second opinions, or if they have questions on treatment or how the clear scoliosis treatment method is different from typical physical therapy, chiropractic, or even just basic bracing. The clear scoliosis treatment method is a non-invasive, non-surgical treatment method to help not just with pain, but to help to stabilize and potentially reduce the scoliosis.
Winter is warming up and spring is just around the corner at Miller Sand and Landscape Supply. I'm Craig Miller, and we've got something for everyone, from bulk materials like sand, gravel, and mulch to beautiful outdoor decor to make your outdoor living space the envy of the neighborhood. See our beautiful selection of Mazzarelli fountains, flowers to brighten your garden, and an outdoor center loaded with beautiful decor. Whether you need a little or a lot, visit Miller Sand and Landscape Supply.
Hey, this is Jason at Reeves Insurance. Just want to say a quick thank you to all of our customers for your support over the years. We now have offices in Anniston, Alexandria, and Oxford in order to serve you better. So stop in and see me or any of our experienced staff and let us shop for you. We'll find you the best price and the best coverage available. Thank you.
The Civilian Marksmanship Program, also known as CMP, is a national organization dedicated to training and educating U.S. citizens in responsible uses of firearms and air guns through gun safety training, marksmanship training, and competitions. Their vision is to lead the nation in marksmanship excellence, providing safe, high-quality, and innovative programs with a focus on youth. For more information about the CMP and upcoming events, visit thecmp.org.
Good morning, everyone, and thank you so much for joining us on WEAC TV 24 Rise and Shine with the Alabama Cares program. I'm Ellen Tibbetts-Hurst, and I'm sitting here today with Dr. John Gatell, and he is with the Atlanta Scoliosis Center. Making sure I get all that right. So we've been learning all things about our spine. And this is very interesting. I hope this is interesting to you guys too. Maybe it'll explain maybe some of the things that you're going through, or maybe get you to even ask some questions or question yourself maybe a little bit to where you can call you guys there and or go to the website, whichever. Like Dr. Gatell says, you do not have to have a referral to come see you guys. So, so we're talking. We talked a lot about the different parts of the spine and all that kind of thing and the different kinds of treatments and stuff. But what, because I know a lot of people out there, including myself, have gone through this and it's not fun. So the sciatic nerve, a lot of people get sciatica symptoms. What are the symptoms that people get?
So with sciatica, well, first of all, the sciatic nerve is the largest nerve in our body.
Yep, there you go.
Yep. You can see, yeah. So the pectoral, the pretty good pectoral. So it shows again where it goes down the leg. But common symptoms that people will have with sciatica, it'll be pain in the back, pain down the leg or into the toes or in the back of the heel. It can be numbness, tingling, pins and needles. Again, pain all following that dermatome, just like we talked about earlier. We were talking about neck pain and how it can present in the cervical dermatome. Well, just like that for sciatica, sciatica is part of the lumbar nerves, and so it can follow the the lumbar nerve distribution or dermatome, and people will feel it into their
And the
feet.
sciatica is on which side?
It's on both. So remember, there's the disc, which is in the center part. There's L1, 2, 3, 4, and 5 for the lumbar. And then those nerves go down. There's 2 nerve roots that come out of each disc level, and then those go down into each leg, the left and the right.
Oh, wow. So, yeah, I remember when, like we were talking on break, I mean, I remember when I had sciatica, it was so bad. It was the most burning sensation that I can't even explain it to someone. It was like I was on fire. And it went all the way down, I mean, into my buttocks and right straight down into underneath my heel. It was like I was walking on like hot, cold pins. I mean, it was just horrible.
Yeah,
horrible.
You wouldn't want it to wish on your worst enemy.
Yes,
Yeah.
I mean, it hurt bad. And you hear a lot of times too that pregnant women get it a lot of times too. Pregnancies, maybe because of everything's shifting in their bodies and that kind of thing. So, what are some other what's causes of sciatica? What can cause it?
Sure. So sciatica can be caused from disc herniations. So disc herniation or a bulge to the disc, putting pressure on the nerve or the nerve root. Then also spinal stenosis, which, if you've been to your doctor, had an x-ray or an MRI, it's common to see spinal stenosis on the report. What that means, it's narrowing of the spinal column. If you were to take the spinal cord and look straight through from the top down to the bottom, it's that canal that starts to narrow. There's arthritis developing in that, and that's what spinal stenosis is. And so if we have that in the lumbar region, then it can affect the
Because
sciatic
didn't your
nerve.
spine fit down, like you said, you were, that was such a good, I guess, demonstration of that, like looking down a telescope or something, right? Mm-hmm. So if you look down, so your spine sits in, what is that called?
The spinal cord is protected by the vertebra, the vertebral bodies.
So it like some of people's narrows, right?
Right. That's right. So that's what I was making the reference where if you were to look down the spinal cord going through each vertebra, it's that hole or that canal that starts to narrow, and that's what can cause irritation to the sciatic nerve.
Maybe cause people to not to be able to turn their necks and everything too.
If it's in the neck, it would definitely cause that. If it was stenosis in the cervical spine, which can happen. If it's in the lumbar spine, they may not be able to twist or to bend, or they may bend over to pick something up and they have that sharp stabbing pain, kind of like you described, that goes down to the foot.
So you could get sciatica through injury, disc herniation, you said.
Yes, injuries, traumas like car accident, a severe, like a sports injury, or one other specific thing would be lumbar scoliosis, which is why people will see us. So when you have a curve in the lumbar spine, where you have the apex or the magnitude of that curve, it's going to put more pressure onto those nerves, and then people can have sciatica.
Oh, wow. And herniations, I guess disc bulges, like you said, that presses on that nerve. That's just what all your spine does out there, people. Your spine is very important to keep it healthy.
It's one of the most important. It's, if not the most. I don't want to be biased, but it is the most important system in our body. It literally controls everything. The spinal cord, our nervous system is composed of our brain and the spinal cord, and then all the peripheral nerves. We're a wired system. It's funny with like the kids who come in. Like everyone's like, oh, we're wireless. Like we're a wired system. So if the wires are not working, then it's going to affect our body and can present with symptoms.
And that makes sense too. So what will hospitals do specifically? If somebody goes into a hospital or to their doctor or whatever, what do they normally do for sciatica?
So if you have to go into the hospital for sciatica, which usually means that the pain is very severe.
Intense,
right, yeah,
yes.
definitely, like a 10 out of 10 or higher. You have to remember how hospitals just in general work. They're triaging to help with the symptoms to get out of pain. So the most common thing they're going to do is prescribe pain medications. They may do some, muscle relaxers or steroids or an injection to try to help with the pain. If it is very severe and it's presenting with other neurological symptoms and they have to do other testing like MRIs or CT scans, they may have to do surgery, of course, especially if it's an emergency case where it is affecting the bladder or the bowel, then that would be something they would do.
Everything's connected, like you said. So, and I guess PT, they do a lot of PT referrals too, I'm sure. Right,
they can refer to PT, but like we just talked about, the most common thing they want to do is they want to get you out of pain, and they're trying to triage, based off of the most severe case in the emergency room.
So tell the audience, versus going to the hospital, which, if you're hurting, please do go to the hospital. I'm not saying that, go to the doctor, but if they're hurting, like you said, that makes so much sense. When you go to the hospital, they're there to fix your pain. They don't want you to hurt anymore. But in the long run, how coming to you versus the hospital, what would the biggest difference be, I guess?
Right, that's a good question. So, a lot of times going to the hospital is the best choice, again, depending on what's happening. But in most cases, it's just going to be a temporary fix or a Band-Aid, to help with the symptoms. And then they're going to say, yes, follow up, do PT, or go to your ortho, have a further eval. And it is making sure that you do address the cause, or you actually do an evaluation to identify what is causing the sciatica is very important, because if not, it's very likely that it can occur again.
It's going to just keep recurring.
Exactly. Right.
And I know myself, I wouldn't want to, when I had back issues, I flat out told my doctor, don't give me any medicine, because I'm not a medicine person. I hate medicine. But I was like, I'll take Tylenol, whatever. But I just, I feel that coming to you would be that fix, because then, because I've taken steroids for my back too, and they're wonderful at first, but it's something that you really shouldn't take long term.
Right, exactly.
Number one, it's not good for you, and then on top of that, it makes you gain weight, it makes you hungry. Then if you're like me, it keeps me up all night. I can't sleep.
It can
if I'm on
cause a
steroids.
whole host of other side effects.
Yes,
right.
So. To me, the choice would be simple. To let's do the long-term thing here. Let's not do just a quick fix.
Right, and like we talked about, thank God there's a place for that. If I get hit by a car, the first place I want to be is an emergency room.
Yeah, correct.
But to actually treat it and then to do therapies and rehab that are not as invasive, that's a lot of times people will find us, or they didn't realize that the degenerative scoliosis that they have now is actually what's causing the sciatica. And so, again, they'll come to us to do therapies or bracing to help with that.
For somebody that wants to come to you, do you guys take all insurances? How does this work?
That's a great question. So we do work with insurances. The best way to find out what type of coverage or benefits you have is to always contact your insurance.
Right.
I would always recommend to contact your insurance provider to find out what type of coverage or benefits you do have. If you do call to our office or go to our website, atlantascoliosiscenter.com, my main coordinator, who her name's Haley, she coordinates all of our intensive patients who come from out of state. If you have questions on the insurance, we have basically an insurance questionnaire that you can use to reach out to your insurance to find out what benefits you have, whether it's for the clear protocols that we do in the clinic for therapy or for bracing. Because even with bracing, a lot of times, depending on the policy you have, it may be limited on what they cover. But even though it may be limited, it doesn't mean that it's not necessary. And that's kind of where you have to, it's just the way that healthcare is in this country.
Right,
So.
true. And there's, I know that my husband has military insurance, and that can kind of be like, hit or miss sometimes, because you have TRICARE for Life, you have TRICARE Reserve, you have TRICARE Reserve Select, you have all these different kinds, and so it probably would behoove everyone to call your own individual insurance plan to see what it covers.
Well, you have to remember too, at the end of the day, like the at a general practice facility or at an individual doctor's office, they don't set the policies of the insurance company. The insurance company sets it. And not to be negative, but it's just, you got to remember they're for profit.
Right, exactly.
So you just have to keep that in mind. But I have seen it over the year. I've been doing this now 12, 13 years. I've seen it over the years where you're your own best advocate, the patient is, and you pay your insurance company. So if you want to get reimbursed, you just have to go through the process, So and I've seen that happen for braces or for therapy. People will get really good coverage,
Well, that's good to know. Yeah. So that's good to know. So you do take insurance and everything. And so if somebody wants to get in touch with you again, well, first of all, the long-term solutions we were talking about, the things that you do for sciatica, but what are the long-term solutions for sciatica? I mean, like adjustments, exercise,
Right, so if someone's coming in for sciatic pain in particular, first we want to diagnose and conclude what the actual cause is. So whether it's going to be from that herniation, whether it's from a disc bulge, spinal stenosis, or from an injury or trauma, we want to rule out what is the actual cause. In our clinic, we'll do the examination, the orthopedic tests, and then we have digital x-rays, so we would get those in the clinic. If we need further testing, like an MRI, then we would just refer out to do that to conclude what,
to make sure you get all the testing, and then it could be different things that you recommend.
Exactly. So each person is going to be case by case, but it usually incorporates. You're right, but it usually incorporates doing therapy in the clinic, or bracing, or it can be both. Just again depends on what the patient's goals are, and also the severity of the diagnoses too.
Right. Hold on to that thought, everyone, because we're going to have to take another short break for a word from our sponsors. And you are watching WEAC TV 24 Rise and Shine with the Alabama Cares program, and we'll be right back.
On average, a tow truck operator is killed every 6 days in the United States. A tragic, yet preventable event. The fact is, most people don't know what it's like being a tow truck operator. The dangers that occur while servicing a roadside vehicle are real. However, you can make a difference to help lower this statistic and save lives by simply slowing down and moving over. This simple task can prevent an unnecessary death and allow workers to make it home to the families waiting for them. After all, it's the law in all 50 states for good reason. Do your part so they can live another day and be there for you when you need them. Move over. Their lives don't belong to you.
Backus Bibles and Books is dedicated to providing churches as well as individuals with products and services geared towards strengthening every relationship with Christ. We specialize in Bibles, Bible imprints, Bible restoration, church supplies, home decor, gifts, and apparel. Call us at 256-201-1202 or visit us Monday through Saturday, 10 a.m. to 6 p.m. at 1100 Highway Drive in Oxford, Alabama. We look forward to serving you, equipping the people of God to expand the kingdom of God.
I want to live. The leading cause of death of young Americans like me is gun violence, and oftentimes tied to substance misuse. NBA, NFL, NCAA, most of you look like me, and our communities need you now more than ever. Let's make I Want to Live more than just a hashtag. Let's make it a movement. I am a baller against bullets.
Okay, so welcome back, everyone. I'm Ellen Tibbetts-Hurst with the WEAC TV 24 Rise and Shine with the Alabama Cares program. I am sitting here today with Dr. John
Gatell.
I always forget how to pronounce it. Sometimes I want to say it right, sometimes I want to, it's the Dutch in me. My mother was foreign, so sometimes I want to say it a little bit different. But anyway, we were talking today about all things spinal, and I think this has been really good information today, and I really appreciate you being here today because I've learned a lot. This is fascinating information, and like I said, I hope that all of you out there watching will share this. Make sure that you can go back and share it and tell everyone to go on YouTube, Apple, Fire Stick, Roku. You can even go back on our Facebook page, WEAC TV 24 on our Facebook page and go back and watch it. But lots of things going on with the spine, very important stuff, you know. It affects everything, your breathing, I mean, your nerves, like you said. I mean, we're just a wired system, and that spine is your central part of it. I mean, very, very important. And we've been talking a lot of things about sciatica. We've been talking about scoliosis, the different types of scoliosis, different parts of the back. So when you have scoliosis, I know a lot of people, I know when I have back pain, this is one of the biggest things for me too, is how do you sleep with scoliosis pain? How do you, why is it so hard to sleep with scoliosis?
So when you have scoliosis, it's affecting the alignment of the spine, which can then put further pressure on certain parts of the body, and that can make sleeping very difficult. There can be trigger points or pressure points that cause neck pain, muscle soreness, back pain, just discomfort, restlessness while trying to sleep. Yeah. So
I can see that. So I mean, when you have fatigue and pain too, I mean, you're not going to get a good night's sleep either. And I can see that. Like I remember, you know, people always say, "Oh, you hear people say I slept wrong. I have a crick in my neck, or because I slept wrong, or that kind of thing." But it's because maybe they have some issues going on with their spine, and they're not really aware of it or whatever.
Exactly.
So what are some best sleep positions and strategies for these people that are having some issues?
So with sleeping, with scoliosis, and you know, even in general too, I think it's good because a lot of times people who don't have scoliosis but they have difficulty with sleeping, the position in which you sleep, there are optimal positions. So the optimal or number one best choice would be to sleep on your back, facing up. If you need to take some pressure off your back, you could have your knees bent or have a pillow underneath your knees if you're on your back. The second best position would be then your side. So again, you can sleep on your left or right side. And this time you'd have a pillow in between your knees just to help with your pelvis and your low back, also for pressure. It is a good idea to have some kind of support under your neck too, just to kind of neutralize the spine when you're laying on the side, so you're not creating a secondary curve, you know, when you're laying.
Right.
And then the position you definitely want to avoid would be laying on your stomach, so laying face down. And that's because, yeah, when you lay on your stomach face down, that can affect the sagittal curves of the spine. So when you think of, you know, how the spine is supposed to be positioned from the front, if you were to draw a line straight from your skull to the center of your sacrum or your pelvis, it would be like a straight line without any tilt or bend. When we have scoliosis, then we see tilting in these vertebrae, which will cause curves. And so when we look at the side of the body, we should see curves. We should see 3 curves. We should see lordosis in the neck and the lumbar, or the low back, and then we should see kyphosis in the thoracic spine. So it should be bending the opposite way in the middle part of your back. But all of those curves and areas of the spine can have pressure, and then it can affect how we sleep.
How we sleep.
Yeah.
So if somebody's out there looking for a new mattress, what should they look for some good support?
Yeah, if there are many different options out there, I think, again, it also depends on your budget too, right? So, but I think having an adjustable type mattress would be a good thing to add if you were going to invest in that. You could have like they have customized pillows now. They have cervical pillows. You can even have a roll that you could put underneath your low back for the lordosis, or to help stabilize that area. But the most important, like if you're going to invest or do anything, it would really be best to invest in your health and just to go have an evaluation done of your spine or the scoliosis, to help determine where am I right now. Has it stayed the same, or has it progressed? Because what adults don't realize is that, or you've been misinformed, which is that, once you're done growing, that's it. But that's been disproven through research more recently. If you have scoliosis and it's over 35 degrees by the time of skeletal maturity, so by the time kids are done growing,
right.
The rate of progression as an adult is about 1 to 2 degrees every year for the rest of their life. And so and that can be for those cases with adolescent scoliosis. Or if it's one of the cases like we talked about that's a degenerative scoliosis, that's going to be a higher rate of progression. And that can affect, like I said, 1 out of 3 people who are 55 years and older. So there's definitely, if you're going to do anything and you want to invest, like I would say invest in getting to the cause of what's causing it, not just getting a new mattress.
Right.
So,
and that would make sense too. I think that would be a very good, wise choice. And so, and then once you go through all that, then invest in a good mattress and some body wedge pillows or whatever you think that so how does Clear help improve sleep? And remind everybody what Clear is.
Right, so Clear is a non-surgical, non-invasive treatment for scoliosis. We also treat other, generalized cases of nerve-related issues or spinal issues. We help a lot of people who have hyperkyphosis or Sherman's disease, where we have these specialized therapies and braces for an increased hyperkyphosis, which is in that middle part of the chest. And so, but the Clear protocols were initially designed by Dr. Wogan about 30 years ago to help with scoliosis. And so there's about 6 different therapies that patients will rotate through in our clinic to help to stabilize the scoliosis or reduce it and to improve the symptomatology. So,
okay, so so Clear can improve the sleep by what?
Right, so by improving the spinal alignment and taking pressure off the spinal cord, that can then affect sleep or improve sleep. It's funny because, like we're talking about, people come to us because they know we help scoliosis, but it's kind of ironic because patients who do therapy and have improvement with their scoliosis, all of a sudden they're like, hey doc, oh my gosh, I can sleep better, or I slept through the night, or and they're doing it all naturally by taking pressure off those areas of their spine.
Not having to take medicines and get dependent on that pill to go to sleep. That's a whole other ballgame. And to me personally, that would be very important because, like I said, I am not a medicine person, so I would rather do that versus having to take something or whatever. So, and one of the things that you sent me was that pre-bed stretches and routines can help, and I actually believe that because I know in the mornings, if I do not stretch, I am so stiff for the rest of the day.
Definitely.
So in the morning, I stretch as much as I can
That's
before.
Excellent.
Yeah, I have to.
Yeah.
Because if not, I can tell when I don't.
We teach our clients, there's 3 basic exercises we teach pretty much every single patient, but it's almost like brushing your teeth, if you brush your teeth, because if you don't brush them, then your teeth decay.
Right.
It's the same thing that happens to your spine. If you don't take care of your spine by doing exercises to mobilize the spine, then it's going to decay or break down, which is called arthritis. And so, when you think of it that way, it's like, oh yeah, well, if I brush my teeth, then I should,
Yeah, right. Right. So
Terribly
same
fun.
thing about, I guess, stretching and exercise. So do you think exercise is a big important thing for spinal health?
Oh, definitely. As I was saying, like with basic movements, like I'll give you an example, just from doing movements where you're bending forward or rotating or laterally bending, all of these movements are to help spinal mobility, but indirectly it's actually causing spinal fluid to pump up and down the cord, which is then lubricating the cord itself. So yeah, I mean there's so many benefits of exercising.
Kind of like when you exercise and oxygen goes all through
Exactly,
your blood system. Same thing with the spine. If it's, that makes sense.
I always get parents will, one of the first questions when people are calling me for a free consult, about their kids, or they're sending me x-rays from CHOA or whatever, their first question a lot of times is, can my kids still do ballet, or can they still play football? And there really hasn't been definitive research that says that one exercise or one type of sport is not good for kids.
Right.
And the way that I approach it too, it's that we want them to be able to do these things that they like. We don't want to take those away, but just like anything else, if they do these activities at a very extreme or competitive level and it is causing pain, that's when you have to double check it. Or if it was one of my patients, I would just well, tell me what's going on. We would check it and see if we can make it better.
And so exercising, you think cardio, like not a lot of weight thing, because that could cause other things, but maybe cardio, some kind of cardio like stretching, you said, all that kind of thing is best for your back.
Yeah, cardio is definitely beneficial. Again, like you said, with oxygen, it increases the oxygen in our body, which is so important. Even on the topic of sleep, as we've been talking about, like this is one of the areas I've been working on for my own health. I have one of these Whoop sport, these tracking things, and I'm like, oh my gosh, my age is now I gained like 2.5 years back on my life because I'm getting the 7 to 8 hours of sleep. And so it's one of those things where it's like we don't think about it like like drinking water, like it's so important, but improving our sleep is so important because it's one of the only times our nervous system can regenerate neurological cells. So it's so important that we get that sleep. There's a lot of research now been going into the
So you're saying don't accept poor sleep as normal, right?
Right, no.
Oh gosh, yeah, I am not. My husband says I must be a vampire in my last life or something, because I am a night owl. But I'm not, I can sleep like 6 hours and I'm good. Mm-hmm. Like, I'm good. I don't, I don't have to have 8 or 9. I don't know. I don't know if that's good or what. But, my grandmother was like that. My mom was like that. I don't know. It's just, I don't know if it has anything to do with me being adult ADD, but it just, I just don't get that 7 or 8 hours. Sure. But maybe I should look into that. I don't know.
It's like anything, or like with scoliosis, you don't want to guess. It's always best to test it, So like if you're questioning any of that, like I would highly recommend to see a doctor who does specialize in sleep, But even just having I've learned so much from having a tracking app, just to see my heart rate variability, to see how much deep or REM sleep I'm getting. And like I said, there's just so much research that shows how important sleep is and how it can also affect not just our physical, but our mental well-being as well.
Most definitely. And if you need to speak to Dr. Gatell, or you're interested in what you do or want to know more about it, make sure to go to AtlantaScoliosisCenter.com. There's the number for Dr. John Gatell, and I'm sure that he and his colleagues can answer all your questions. Hopefully, maybe, right? He's over here smiling. But yes, he will. He's very knowledgeable.
You're setting the bar very high.
No, but you're so knowledgeable. I really appreciate you coming today, because this has been very interesting. It's made me think a lot, because, I was diagnosed with scoliosis when I was young. So, this has got my wheels turning here. So, that's very interesting, and I really appreciate you coming today. So, thank you for today, and I hope that you guys learned something today, because I know I have. And don't forget that we will have our monthly community health series on Tuesday, which is September 9th from 10 to 12. We will have Dr. Clark, an MD. She's going to be speaking, and we will also have vendors along They're as well doing glucose, blood pressure checks, hearing and vision checks. We may actually have flu checks and stroke checks too. I'm not sure. I'm working on that. Please share this, and don't forget we all have door prizes as well. We always have great door prizes, and every month it's a different subject. Like I said, September is aging awareness, health awareness, and then October, cancer. November is caregivers month, caregiver Alzheimer's month, and then December we have holiday wellness. And actually Dr. Gatell even said that he's going to try to make it to the holiday one in December. Let's hope and keep our fingers crossed. That would be great to do scoliosis screenings. That would be great.
Yes.
So make sure that you come to these events. Like I said, it's from 10 to 12 on this Tuesday, September 9th, and we hope you have a wonderful weekend, and be safe out there, and enjoy another football Saturday, and we will see you next week, and hope everyone has a great weekend. Bye,
Thanks for having
everybody.
me.